What is dengue fever? Dengue fever comes from a certain type of mosquito bite. This mosquito can carry one of 4 kinds of dengue virus. You mostly find these mosquitoes in warm areas like tropical and subtropical regions. Places like Central and South America, Africa, some parts of Asia, and the Pacific Islands. You can't catch dengue from another person, except sometimes a pregnant person can pass it to their baby. When you first get dengue, the symptoms are usually not too bad, but if you get it again with a different kind of dengue virus, it can be more serious. Who does dengue fever affect? Dengue fever is mostly seen in Central and South America, Africa, some parts of Asia, and the Pacific Islands. There are also a few places in the US where it can be found. If you live in or visit these areas, you're at the highest risk. More than half the people in the world live in or travel to these regions. Children and older adults are more likely to get seriously sick from dengue. How common is dengue fever? About 400 million people catch dengue fever every year, according to research. But here's the thing. Most of them, around 80%, don't even feel sick. What are the symptoms of dengue fever? Dengue fever can be tricky because most people who get it don't even feel sick. But if you do have symptoms, they usually start showing up about 4 to 10 days after a mosquito bites you. The main ones to watch out for are a really high fever, a rash, intense pain behind your eyes, feeling sick to your stomach, and achy muscles and joints. These symptoms can stick around for about 3 to 7 days, but for about 1 in every 20 people who get dengue, things can get serious. They might develop what's called severe dengue, which is really dangerous and can even be life-threatening. If you've had dengue and start feeling stomach pain, throwing up a lot, bleeding from your nose or gums, or just feeling really tired, you need to get to the nearest ER fast. It's super important to get help right away. What are the causes of dengue fever? Dengue fever is caused by viruses called dengue viruses. When a mosquito carrying one of these viruses bites you, it puts the virus into your blood. Then, the virus starts making more copies of itself inside your body, which can make you feel sick. The virus can also harm parts of your blood that help it clot and keep your blood vessels strong. This, combined with some chemicals your body makes to fight the virus, can make your blood leak out of your vessels, causing internal bleeding. This is what makes severe dengue so dangerous. How does dengue fever spread? Dengue fever spreads through mosquitoes called Aedes mosquitoes. These mosquitoes can also carry other viruses like Zika and chikungunya. When a mosquito bites someone who has dengue fever and then bites someone else, it can pass the virus on to them, making them infected too. Is dengue fever contagious? No, dengue fever doesn't spread directly from person to person like the flu does. The only way you can get it from another person is if you're pregnant. If a pregnant person gets dengue, they can pass it to their baby either during pregnancy or when the baby is being born. How is dengue fever diagnosed? To diagnose dengue fever, your doctor will do a blood test. They'll take a little bit of blood from your arm and send it to a lab. There, they'll check for signs of the dengue virus. This test can also tell which of the 4 types of dengue virus you might have. Sometimes the doctor might also test for other viruses that can cause similar symptoms. How is dengue fever treated? Unfortunately, there isn't a specific medicine for treating dengue fever. Instead, your doctor will give you advice on how to handle your symptoms. They'll tell you what you can do to feel better and when you should think about going to the emergency room if things get worse. How do I manage the symptoms of dengue fever? To manage the symptoms of dengue fever, you need to follow your doctor's advice. They might suggest drinking lots of water and other fluids to stay hydrated. It's also important to get plenty of rest to help your body fight the virus. If you're in pain or have a fever, you can take acetaminophen, like Tylenol registered trademark, but avoid ibuprofen or aspirin as they can make things worse and increase the risk of bleeding inside your body. How can I reduce my risk of dengue fever? You can lower your risk of getting dengue fever by avoiding mosquito bites and getting vaccinated. Mosquito protection. To protect you from mosquitoes and reduce the risk of dengue fever, Use insect repellents that contain 20% to 30% DEET or other effective ingredients. When you're outside, especially at night, wear long sleeves and pants to cover your skin. Eliminate standing water where mosquitoes can breed, such as in buckets, bird baths, and old tires. Make sure your home is secure by fixing any holes in window and door screens to keep mosquitoes out. In areas where dengue is common, use mosquito nets at night. If you're pregnant, try to avoid traveling to places where dengue is prevalent. Before traveling, always check with the CDC to see if there are any dengue outbreaks at your destination.